again, the ban on pre-existing conditions, denial for pre-existing conditions would certainly help. The general discrimination against women, against anybody who's perceived as being HIV positive, is outrageous. It's an insurance company abuse. That's why we're seeing all these demonstrations against insurance companies and why we need a public option. Because a public option would be fairer and it would be cheaper. Not as cheap as we would like, because we're not getting the robust public option, but we need it. And we need the opportunity for women and for other people who are discriminated against to be able to get a fair, affordable health insurance policy.
But the problem, Lois, is that they're going to make that public option behave like an insurance company, right?
I agree.
That's a real difficulty. And maybe the whole paradigm of insurance is wrong. Just think of it. You buy car insurance or house insurance, you hope you'll never have to use that insurance, right? I mean, you don't want your house to burn down. You don't want to get into a car accident. Health insurance is, it's the wrong term, right? We don't want health insurance because we all know at some point in our life we're probably going to get sick. And in fact, we want younger people to use preventive services. We want people to use their insurance.
We do.
Which is the exact opposite of, what most insurance is about. That's why we talk about a national health program, Medicare for all again, trying to get out of the insurance paradigm. For instance, in Medicare, you don't pay premiums per se for the Part A part of it. It's part of your, payroll tax.
And can you get there from here? Medicare for all from what? From the public option if it is passed as it is in the Senate and the House?
I fear that it's going to be very hard to get there
I think
through the public option.
We're not getting there now because we're not seeing Congress leaping tall buildings in a single bound. They're just not going to do it.
Well, I think the problem for Congress is this. 94% of American voters have job-based coverage or some other kind of coverage, and they are scared. If they, this is what people say, what the pollsters say. I'm not sure if this is right or not, but the pollsters tell us that the folks are scared to have too radical of change. I'm not scared. I want radical change, but I don't think I'm going to get it. And I don't think, and fortunately, Congress is not an avant-garde entity. and so I think that's...
And they're each and every one of them are well insured.
Yes.
But it depends on the pollsters that you look at. So you get an NBC, New York Times poll that said, would you prefer the current system or a Medicare-like system run by government, financed by taxpayers? Two words that I thought would put most Americans off on some level. And what you get is, 60, 65%, it depends on the year that this poll has been given, in favor of a Medicare-like program. And again, I think, what we needed was a Democratic president, a Democratic Congress. And I thought we could get this, actually.
I think what's really clear is that it was wrong to take single payer off the table at the beginning. Just because I think we would have had a much better and more well-informed debate. I think we would have more money to do whatever the outcome was. And it's actually we did ourselves as a country a disservice by taking it off the table at the beginning.
Is there a place for activism right now?
Well,
two different trails, I would say.
Yeah, what you see, one place for activism that's real simple is the Weiner Amendment. Let's be sure that Nancy Pelosi still has to let it come on to the Senate, the House floor. And so I think a lot of pressure should be placed on Pelosi.
And there are people being arrested all over the country in front of health insurance companies.
Secondly, what we have, it seems to me right now, is a major force similar, it seems to me, to the civil rights period, where people really feel this is a life and death issue for them, and that private health insurance companies are really the barrier to getting us to a national health program.
There's also another.
10 seconds.
Okay, there's another area for activism. If you care about immigrant coverage, you need to contact your House of Representatives. And if you care about the affordabilities, the current proposal is to do more for middle-income people at the expense of super low-income people. That will really hurt folks. We need to contact the Senate.
We're going to have to leave it there. Elisabeth Benjamin, I want to thank you for being with us, Vice President of Health Initiatives at the Community Service Society of New York. Lois Uttley, thanks for being with us, co-founder of Raising Women's Voices for the Healthcare We Need. And Dr. Oliver Fein, President of Physicians for a National Health Program, Professor of Clinical Public Health at Cornell University.